So the topic of my presentation is return to play considerations for ACL injuries in the female athlete. And I was supposed to put this slide. So the focus of this presentation is the differences between the females and males related to the ACL injury, outcomes after ACL reconstruction, and also factors affecting return to play. ACL injuries are common, and especially in sports. Females have 2 to 9 times higher risk to get injured compared to men. And the amount of ACL reconstructions that are performed are increasing. And between the years 1994 to 2006, the amount of ACL reconstructions nearly doubled for the females, but only increased for 10% for the males. So actually there's a problem with the female ACL injuries. The most common sport that the athletes get the injury is quite similar for both male and females. And this is data from the Swedish ACL registry, where you can see that for the males, it is most common to have it during a soccer play. And for the females, is maybe, yeah. That's better. Yeah. No, but I can hold it.
Okay.
It's okay.
It's better.
That is better, maybe. Yeah. So I can hold it like that. Yeah. No, that's better. Good. For the males, it's the most common is doing soccer play, and that is also for the females, but also in other sports like alpine skiing and the European handball. And in the literature, you can find a lot of factors that actually increase the risk for the knee injuries in females. And generally, we're talking about increased general joint laxity, increased quadriceps angle, increased posterior slope of the tibia, decreased notch width, smaller ACL cross-sectional area. That is more anatomical factors. We're also talking about hormonal factors that may differ between males and females. And also, quite a lot of focus have been placed on the biomechanical factors, for example, the knee valgus during landing or the external rotation. And actually more risk factors have been described in the literature, but it is not always easy to prove exactly the risk factors. But this is what we can look at. But the most important here is to return to play. And you have already seen this paper from Claire. There's a systematic review looking at the rate of return to sports. And for the general, for both males and females, the numbers for return to sports are like that. Quite disappointed, as Claire said before. But how is it for the females? If we look differences between males and females, this is the same paper. We can see that return to any sport, there's actually no difference between males and females. It is 80% for males and 75% for females. Then we have a difference in return to pre-injury level sport, where the females has a lower rate of return to sports compared to males. And also looking at return to competitive level, we're also the same pattern, where we have a lower return to play for females compared to males. And also, as Claire said before, the males have actually 1.5 times, they are 1.5 times more likely to get to return to play compared to the females. How can these differences be explained? I would like to answer to that question, but it's quite difficult. But we have to take into account again that return to play is multifactorial, so it's not easy to talk about. And many different factors affect it. And between the different factors, we have both physical and psychological, and more than that. So looking first at the physical factors, we have a nice paper published this year. It's a systematic review with 135 publications and more than 120,000 patients. Nearly half of them are females. Looking at the outcomes after ACL reconstruction. And here you can say that generally females have inferior outcome compared to the males. And more specifically, they found that there were statistical inferior results looking at the instrumented laxity testing, the Lysholm score, the Tegner activity score, and also the incidence of not returning to sports. Other parameters that they looked at that were not significant difference were manual laxity testing, hop tests, muscle strength, range of motion loss, and the IKDC score. Among that, they also found statistically increased rate of revisions for the females. Can you hear me? Yeah, good. But no difference in the graft rupture or failure. But I'm coming back to these results because these are not clear and we have some conflicting results. So this was the physical factors, and then looking at the psychological factors. As we heard before, we know that low fear, self-motivation, confidence, positive mood and emotions, psychological readiness to return to sports are factors that facilitate return to sports. But that is both females and males. And I have not found any paper or anything in the literature that looking at the differences between females and males. So these factors actually apply for females also, but we don't know if it's any difference between the genders. And talking about return to sports, we need also to define and to see what we mean with a successful return to sport. And as we also already heard, it is just to return or it is continue to play, and at what level we're looking. We follow in a study a cohort of female football players, and you can see the poster outside here. And in this cohort, we include females aged 16 to 25 who injured during football play. And these females are 6 to 36 months after the ACL reconstruction. We have followed 218 females, and of them we have 40% returned, 40% not returned to football, and 60% returned to football. But looking at the numbers of these girls who returned, we could actually see at the follow-up time, 72% of them will continue playing, but 23% of them just played once or twice, or maybe for some weeks or months, but then stopped play again. So the population of return to sports should be defined more specifically. Another factor that determines the successful return to sport is the absence of new injuries. And it is a large risk for new injuries after the ACL reconstruction. Here we have again data from the Swedish ACL registry, where we have more than 21,000 patients, looking at the revision rate and the rate of contralateral injuries. It's quite busy figure here, but you can see that at 4 or 5 years follow-up after the ACL reconstruction, the proportion of revision is 4.3% of revision reconstruction and 3.8 reconstructions in the contralateral knee. So it's quite high. And looking more specifically here, we can also see that the revision rate is more common within 2 years after the ACL reconstruction. And that may be affected because they return to sports too early. Looking at the contralateral knee, it is more spread out during these 5 years. So looking at the predictors for new injury and revision for both females and males, it is a young age, it is playing football when getting injured, but also return to play, return to sport is a predictor. And as Håvard said before, also early return to sport is a predictor for getting a new injury. My talk was about females and males. So it is conflicting results looking if it is an increased risk for the females having a new injury or a revision or a new injury to the contralateral leg. There are many papers out there saying both the one and the other side. So it's conflicting results there. The last part of looking at the successful return to sport is if we have the late consequences, for example, osteoarthritis. And the question is if it is an increased risk for osteoarthritis for females. And there are no evidence for that. So the risk is similar for both males and females. though some papers suggest that the female sex is associated with osteoarthritis after the ACL reconstruction. And also that is an increased risk for females to have a knee arthroplasty 15 years after the ACL reconstruction. But there are no results and no studies looking in relations between females, osteoarthritis, and return to play. So we don't know yet. Should be interesting to look at that later. The next question we can look at is who return to play? And looking again at the same cohort that we follow, as I described before, we have compared the girls that didn't return and the girls who currently play football. And we follow them with the questionnaires. And we could find that the females who currently play football had a higher playing level before their injury. We could see that the physiotherapist contact was most important. That is good in this, for you working with these patients. They also stated that the main reason for playing football before the ACL reconstruction was actually to win. We had the questions if it was for fun or for social reasons or for health, but they wanted actually to win. And looking at different personalities, these females who returned to play were more adventure-seeking and had a higher personal standard, so more perfectionism. And the two most important factors here was a shorter time between injury and the ACL reconstruction, and also a higher motivation to return. So if we need to ask the patients already from the beginning how motivated they are, and then maybe looking at the motivation through the rehab time as a very important factor to actually get them back to sports. In the same cohort that we have, we are also looking at how is the function of these girls when they actually return to sports. And it is a PhD project for Anne Fellström. She is here if you want to have more questions on that. And now we compare the females who are actually playing with healthy controls, girls in the same age playing in the same team that are tested both. And Anna has done a lot of performance testing for these girls. And it is both single leg and double leg jump tests. And it is also a balance test. The results for this study shows that looking at the ACL injured girls, the ACL reconstructed girls, it's no difference between the injured leg and the non-injured leg. So the rehabilitation was good. All are cleared to go back to sports, all play football. So that is good. Then in the comparisons between the ACL reconstructed and the healthy girls, the only differences we could find was at the 5-jump test, where the ACL reconstructed players performed worse than the controls. And also at the drop vertical jump, where the ACL reconstructed girls actually had less knee motion in the frontal plane, so less valgus compared with the controls. That means that looking at the valgus as a risk factor, actually the healthy girls have an increased risk factor compared to the ACL reconstructed girls. And in these results, we're looking a lot about the limb symmetry index and see how important this is. For most of these tests, we have also some cutoffs about what is normal function or the recommended guidelines for individual tests. And looking at all the girls, both ACL reconstructed and the healthy players, it was between 9 and 49% of all players that had results classified outside the recommended guidelines in each individual test. So it doesn't matter if you have reconstruction or not, you have actually quite bad function. This is an example of a healthy girl with no ACL injury, playing in the highest level of football in Sweden. So we're looking a lot about the movement asymmetries and the high prediction knee adduction moment pattern. And coming back to the discussion about the limb symmetry index, we have said before also that we should have more than 90%, or maybe we should have 100%, 110%. In this cohort, we found that many girls had actually more than 100% in the injured leg compared to the non-injured leg. And what we want to have is symmetry. We don't want to have asymmetry. So I think that we can question also if it is good to have two high levels for the injured leg when we know that it's quite a big risk to actually injure the contralateral leg also. In the same testing protocol, we've also looked at the tack jump test. And here's one girl performing the tack jump test. And she's an active football player in Sweden. I think that we are quite good in football. Performing this test in this way. And we have to think a little bit. And this girl has not had any ACL injury yet, I can say. So I think that this is not okay. We have to do something and look about the function of our athletes being outside and doing sports. So the take-home message from this talk is that the males are 1.5 times more likely to return to play compared to the females. Generally, females have inferior outcome compared to the males. There's no evidence for sex differences, either in psychological factors related to sports or the re-injury or revision rate. After return to play, there are only minor differences between ACL reconstructed girls and controls. And actually that both ACL reconstructed and controls had results classified outside the recommended guidelines in functional performance testing. So thank you.